Hi, it's Dr. Eric Perman from Summit Dental Care, and today we're going to talk to you about a subject today called diagnostic wax-ups. So a lot of times people or patients will present to our office with several factors. One can be a lot of decay. Another factor can be severe attrition, where they've worn down their teeth to where they've lost quite a bit of height to their teeth, and that's affected their joints, their muscles, their facial profile. And so those patients are wondering what options are out there to help restore form and function for them. And one of those things is the diagnostic wax-up. And then the other thing can be aesthetics. Patients will come in, they're not happy with their smile or they're not confident in it, and so they want to know what options are out there. And so before we do anything in cases like this, we can take an impression. And with this impression, we send it to a qualified dental lab that then does a mock-up of what the end result will look like before we even touch the tooth on the patient. So here was a patient that presented to the office with severe occlusal decay, missing teeth, and they were to the point where they wanted to be able to smile. They wanted their teeth to be healthy looking. They wanted to be confident in themselves out when they're out in public. And so we took an impression of their existing dentition as they were here, and then we sent it to this lab, and we were able to get a diagnostic wax-up back from the lab. So this shows the patient what our end result can be before we do anything in their mouth. And so they have an idea of what things will look like, what they'll possibly feel like, and just the overall outcome before we do anything. And so it's really been great for patients to be able to see that and have an idea, kind of a test drive, so to speak, before anything's done in their mouth. So not every patient that comes into Summit Dental Care needs full arch rehab. That's pretty rare, to be honest with you. So a lot of patients come in and they're not happy with their smile. They're not confident when they're out in the public or around their friends. And so one of the things that we can do with the diagnostic wax-up is bring them in, take an impression, send it to the lab. The lab will then send us back a result that they can look at, they can critique, they can change or adjust, and get that smile to where they want it to be. And so that way we know beforehand what the outcome's going to be before we even touch the tooth. And then that patient is able to really participate in the process and be an active partner in determining their own outcome. And it's just been wonderful to see patients light up when they see the possibilities that the diagnostic wax-up gives them that information. So if you're not confident or happy with your smile, give us a call at Summit Dental Care, and we'll work with you and get you the smile you want.